And COVID cases also continue to fall in Sacramento County, but health officials are still concerned about the number of people who are in the hospital, including kids.
Health officials say 603 people are in Sacramento County hospitals with COVID. 102 of those patients are in the ICU, and 24 of those hospitalized are children. Officials say this is further proof that COVID can be serious for some children. And health officials also say the risk of hospitalization is 11 times higher for children who are not vaccinated. Right now in Sacramento County, 7 in 10 children from 5 to 11 years old have not received a dose of the vaccine.
COVID-19 is a childhood illness. We protect our kids from other illnesses by routinely vaccinating them, and for COVID-19, this is no different.
And in fact, children now make up the majority of the patients with COVID-19 infections at the UC Davis Medical Center.
As KCRA 3's Stephanie Lynn tells us tonight, doctors are raising some concern about dangerous health complications that is affecting some unvaccinated kids.
They can be really scary sick.
Doctors at UC Davis escalating concerns over dangerous long-term impacts of COVID in unvaccinated children.
They can have involvement of their brain, of their heart, of their kidneys, and any of those can be damaged.
He's talking about MIS-C, or multisystem inflammatory syndrome. We've followed it since the pandemic began. Today, medical experts raising the alarm yet again as COVID cases among kids surge. Children now making up the majority of infections at UC Davis Medical Center.
Parents really can't miss this.
MIS-C is rare, impacting 1 out of every 3,000 children who get COVID. But it can be deadly, and more kids are getting it, sometimes when it's least expected. Symptoms can show 2 to 4 weeks after a child has recovered from COVID.
The children develop high fever associated with many different symptoms, the most common being things like rash, vomiting, diarrhea, abdominal pain.
New data from the CDC finding certain groups disproportionately affected by MIS-C. 59% of MIS-C cases nationally are among Hispanic, Latino, or Black children.
We think it's likely related to more exposure because parents are more frontline workers and have increased risk of infection.
Long COVID also a problem that could last for years.
They might have lingering cough, fatigue, sometimes fever, headache.
Emphasizing the importance of getting vaccinated. A new CDC study finding 2 doses of the COVID-19 vaccine had a 91% effectiveness rate against MIS-C.
There's no question in my mind that vaccines are safe and effective.
In the U.S., 50 children have died from MIS-C. The disease can also infect young adults. Reporting in Sacramento, Stephanie Lynn, KCRA 3 News.